Mental Health Awareness Week. So we invite our esteemed faculty member, psychologist Veena Panjwani, and Veena ma'am would be explaining to us the importance of mental health awareness uh, and all the core issues related to mental health awareness that we all need to know. Veena ma'am, over to you now.
Thank you, Nidhi. Am I audible? All right. A very good evening to one and all. I thank Dr. Palan and Professor Rakesh Jain for giving this opportunity. And 10th October is celebrated as World Mental Health Day, and it is organized by World Health Organization. When it was first announced, they also gave a definition of what is mental health and what is mental disorder. And I would begin my talk with a very simple clarification here. Any kind of disturbance in thought, in emotions, and in behavior. If any of these disturbances impact a person's functioning in the personal, interpersonal, social, occupational, and spiritual areas of a person's functioning, then it is identified as mental disorder. So, the well being of a person is also recognized as something which is not merely an absence of a disorder or a disease. That mental health and mental well being and overall well being of a person is indicative of not only absence of a disorder or a disease, but also a healthy functioning in all these 5 areas of functioning of a person. That is interpersonal, that is a person's relation with one's own self, that intrapersonal. Then there is interpersonal, that is relation with near uh, ones, that is family members and close relations, and social, that is outside the family, so all the social relations, friendships, occupational, that is workplace interactions, functioning, the ability to finish work, the ability to reach on time and leave on time, and spiritual, and that is a person's connection with something which is beyond, not limited to a person's concept of self only. So, Dr. Rakesh Jain has been mentioning that spiritual coping is one of the best coping, and I would say that yes, and not only in grief, in all difficult circumstances, spiritual coping is considered as one of the best, most effective ways of coping. Coming down, I mentioned with, I began the talk with mentioning that any disturbance in thought, in emotions, and in behavior. So, what are these disturbances and how are they impacting a person? I am going to focus on very common observations of disorders and I also want to bring attention to some of the misconceptions which are coming up because of, again, the fact of overgeneralization on social media, Instagram particularly. Uh, so, to begin with, disturbances in thought that something bad is about to happen, anticipating something wrong is going to happen. Then, disturbance in emotion, that the emotion is not situation specific, it is not the incident specific, that it is uh, more prevalent, as in it is lasting for long, and that it is more than required. So, a person who is happy more than what is appropriate, and a person who is angry more than appropriate, a person who is sad more than appropriate, they are all disturbances in emotions. And disturbances in actions, wherein a person is unable to have a control, have a regulation over what they speak, what they do, and how they do it. A combination of these three would result in a long term disruption in adjustment of the person with oneself or with other people around or with the work that they do. So their work relationship is also affected. And like I already mentioned, the spirituality is also affected. Now, a very common debate nowadays is happening about anxiety, and there's a lot of misconception related to depression. To my surprise, 10-year-old people, 9 years old, come up with words that, oh, I'm feeling depressed, I don't want to go to school. And I ask, do you know what feeling depressed is? What do you mean by that? And a 13, 14-year-old person saying that, "Ah, I was feeling so anxious, I did not want to do it." And if I ask, what do you mean by anxiety? What is it? And are you so sure that you are suffering from anxiety? Or is it so that the anxiety is aiding you, is helping you in your functioning? And sometimes they do not have a clear answer about these questions because they have picked up some words from various places, especially post pandemic. So much of exposure to screen time, and the entire world is available in their hands. So, a little bit of clarification. All of us experience anxiety, and it is necessary for all of us to be functional. Anxiety is positive till the time it is aiding us, it is helping us in completing some tasks. If we do not feel that base level anxiety, then we will not have the readiness to engage in a task. But when anxiety goes beyond a certain level, that it begins to impact learning and functioning of a person in a negative way, then only it is recognized as pathological anxiety. So, the heightened alertness in our system that we experience, that we have learned to recognize as anxiety, is necessary for us. It is time that we appreciate it, we accept it, and we realize that our interpretation of our physiological changes is important to give us the meaning that we give to our experiences. For an example, suppose you have an exam 6 months from today. Would you feel ready enough to study for it? And suppose you have exam 6 days from today. What would be your readiness for the same exam? And suppose you have an exam to appear in after, say, 10 hours. Your readiness then, every single time, your mental alertness, your physical alertness is different. And that alertness itself, when is translated at the bodily level, is the experience of anxiety. But if you have your exam after 6 minutes and you have yet to finish your preparation and all the thoughts that come to your mind, and each one of them, when they tell that, oh, I have not prepared, oh, I'll not be able to write my exam, oh, I'll not be able to clear this exam, and what consequences it will have for me, then that anxiety, that alertness, it has become pathological because it is not serving you. It is not working in your favor. It is bringing helplessness to you. Now, when this helplessness is continued for a certain duration, it is identified as anxiety disorder, which has various types. I'm not going into details of those due to lack of time. But over a period of time, this helplessness, that I'm unable to do anything, I'm unable to do something, when it gets converted into hopelessness, that I will not be able to do, then the anxiety disorder progresses into depression. Depression is pathological sadness, long term sadness, which a person is unable to overcome. This distinction is important to realize, to understand, because the latest statistics which tells us that after the pandemic, there has been a surge in three main mental disorders. One, anxiety. Second is depression. And third is insomnia, inability to fall asleep or maintain sleep. Now, these three conditions are very physical in nature. What do I mean by this? Just give me a minute. Yes, I was referring to the physical nature of the conditions of anxiety, depression, and insomnia, that they are all regulated by the primitive brain, or the reptilian brain that we say is there in our brain, which regulates our basic physiological functions. And post pandemic, due to the changes in lifestyle and the sudden experience of intense and long term fear that people had, some changes have taken place which have brought a level of sensitivity. The threshold is reduced now, that people find it, um, they find that they are more reactive, or they are easily um, susceptible to certain reactions which earlier they were not seeing in themselves. And it is not that they are alone in this experience, that they are observing more of this around them. And it is a reality for today. The World Mental Health Day theme for 2022 is mental health in unequal world. And the aim is to provide mental health services equally for everyone, just so that people who are struggling with issues, they gain that awareness that they don't have to suffer in silence, that if they see some areas of their functioning are getting impacted, I have counted 5. If 2 or more than 2 of these areas of functioning are getting impacted for more than a few days of duration, then they must speak to someone who is a qualified professional who can provide help, aid them in gaining a mental health for themselves. Like any other physical health issue, mental health issues are equally important. So I would like to stop here. If you have any questions, please ask. Thank you for your patient hearing.
Thank you. Thank you, Veena. You narrated everything in very simple way. I liked it. Anybody want to add something or ask anything to Veena? Comments, please. Dr. Rakesh, I would again invite you to say a few words.
Yes, sir. It's a
Please.
very good. Sir. Can you please enable my screen share, sir?
Yes.
So it's a very good presentation, Dr. Veena. In brief and effectively, you have presented the most prevalent anxiety disorder. It's a common mental health disorder with very high prevalence. So I want to present this, giving some statistics. So what happened?
Welcome, sir.
Something is wrong. I wanted to present some statistics. Yes, sir. Yes.
You are a co-host. You'll be able to present.
Yes, sir. I'm presenting some statistics.
That will be useful. Very true.
It should be. Is it visible, sir? Sir, is it visible, sir?
If it can be enlarged by some means, I don't know.
Yes, sir, it is visible.
Good. Right.
So this statistics is from National Mental Health Survey conducted by NIMHANS in partnership with other institutions and government countrywide. So according to this survey, total mental morbidity, the mental illness was seen in 10.6% of the cases. That amounts about 13-14 crore people affected by one or the other minor or major mental disorder. Out of that, 10% of the cases are suffering from common mental disorders. Common mental disorders means anxiety, depression, phobias like that. And 0.8% are suffering from severe mental disorders. The total number of persons suffering from mental health conditions is huge. One more slide I want to present. I want to change this slide. And one more, one minute, please.
Please take your time.
Yes, please. I'm working from my mobile today. Is it visible, sir? Is it visible, sir?
Yes, so we can see.
Anji,
Yes.
visible, visible.
It is from the same survey. This figure is reflecting the treatment gap for mental disorders. That means the persons are either not receiving any treatment or receiving inadequate, insufficient treatment. For bipolar affective disorder, 70% of the patients are not receiving proper treatment. 75% psychotic disorders, major depressive disorder 85%, neurotic disorders 83%, alcohol use disorder 86%. That means majority of the patients suffering from these disorders are not having proper treatment either due to accessibility or other conditions. So our aim in this mental health week is to make the public aware. Public awareness is one of the issue which restricts utilization of mental health services, and removal of the stigma, which is more of a social problem. The persons with mental illness are seen with some negative features. They are discriminated. People maintain distance from them. So these are the issues which are coming on the way, in the way of treatment, effective treatment, and reaching the patients. So I think these are efforts of enhancing awareness of mental health conditions, their treatment, availability of treatment, will increase the utilization of services, and more and more number of patients will get proper treatment. The government of India has already launched various programs that includes National Mental Health Program, District Mental Health Program. In District Mental Health Program, every district is supposed to have a team of mental health professionals that include a psychiatrist, a psychologist, social worker, and psychiatric nurse. It has already been implemented in many districts, and government is training the doctors in PSCs, CSCs at every level. So I think in coming days, coming years, we shall be in a better position to reach to the patients, and also in educational setups, UGC and all other educational institutions, they have taken lead for making a counselor available in educational institutions, which will also help the persons affected from various conditions in restoration of mental health. Thank you, sir.
Thank you, Rakesh. Santanam sir, you being a very senior psychologist, would you like to speak a few words on this mental health awareness?
Yes, sir. Yes, sir. Yes, sir.
Please.
Thank you, sir. Thank you very much for giving this opportunity.
You're welcome.
Yes, sir. So thank you very much for presentation given by Rajesh Sharma ji and Dr. Veena Panjwani and Dr. Rakesh Jain has given the statistics actually collected by NIMANS. Sir, actually, this during this mental health awareness week, even in Tamil Nadu, many organizations, including my organization, we are giving some kind of awareness program. And another thing, actually, as far as the Tamil Nadu is concerned, there is a very old institution. It's called the Institute of Mental Health. Now, the government of Tamil Nadu, actually, they are taking a lot of initiative to convert this state government mental hospital, which is otherwise known as Institute of Mental Health, on par with the National Institute, on par with the NIMANS. Actually, some kind of, fund also, actually, it has been allotted for developing that state institute at the level of the National Institute, sir. Another thing, actually, as Dr. Rakesh Jain said, the mental illness, still it is considered as some kind of taboo among the public. Even I used to say, generally the people will say, yes, I have appointment with the cardiologist. Today I have to meet my cardiologist. Today I have appointment with the neurologist. Today I have appointment with the diabetologist, like that. But nobody will say I have appointment with a psychiatrist or a psychologist, because they are having some kind of negative opinion about their illness. Even the patient himself, they're having some kind of negative opinion about the illness. They think actually the moment they try to reveal that particular illness, how for the other people, even their own, family members, how they perceive them, like that, they are having some kind of negative opinion about the disease. So now it is a time. Actually, it is a time for the mental health professional to create some kind of awareness about mental illness. Even as our Dr. Rakesh Jain sir rightly pointed out, even the medical fraternity, even they do not have proper understanding about the mental health or mental illness. We are giving lot of importance for promoting the physical illness. Even many hospitals, they are mainly concerned about the physical illness rather than the mental illness. Even if you go to a hospital, a big hospital, even in corporate hospital, there actually we can see the prominent the specialty like cardiology, neurology, orthopedic, and so on. Whereas the importance given for the psychiatry or psychology is very much limited. So that is the reason why actually the people, the general public also should understand the mental illness is like any other physical illness. It is also curable, it is also treatable. Once this mindset is set in among the general public, definitely they will come forward even for a slightest disturbance. As Madam Veena Madam said, even nowadays the children, because of the impact of the Google, even the school going children, not even the 10 years old, even below 10 years old children also telling they are having some kind of anxiety, they are having some kind of depression. So that is the reason why. So what I suggest, even the awareness should be created in an effective manner to understand the mental health issues, so that there will not be any kind of misunderstanding, any kind of negative opinion or negative attitude towards this issue, sir. So it is my humble suggestion to our participants, sir.
Thank you.